Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. All right. We're in time. We are 4th of July weekend.
Yes, happy 6th of July.
6th of July. Did you do anything fun this weekend?
I actually did. I went down to AC with Deb, and we went to the karaoke bar, and I won an award.
An award?
Yeah, I did, for best singer of the night to that point. Yes.
Wow. All right. I'm taking you to a karaoke contest. Let's go. Was there a prize?
Exciting. It's like a little trophy. I have it downstairs. But
you need to display that right on your mantle.
But yeah, well, we really wanted to go. And I said to her, it doesn't open until 9. And so she was bored. So we're literally standing outside before it even opens. So we're the first ones in. And for the first half hour, it was just me and her singing to each other. And then the staff listening to us, cheering us on. And then more people started to come in and, we still sang, and it was fun. I like karaoke bars if people have never been. For the most part, everyone is just excited and cheers each other on, whether you're a good singer or a bad singer. People sing along. There's this one guy, his timing was off, and the whole audience was trying to get him back on the beat and singing with him, and it was just so cute. So
I think 2 out of the 3 times I've been to a karaoke place, it was with you.
Well, it was an awkward moment at the karaoke bar because do you know that song Higher?
You going to sing it for me?
Yes. So that one. So there's a line in it about helping the blind man see. And it's just the lyrics of the song. Mm-hmm. But literally, while the guy was singing that song, a blind woman walked in.
Oh, gosh.
And then everybody would be they didn't want to sing that part of the song anymore. And I was she knows she's blind. She knows it's lyrics to a song. It's not that serious. It's just what are the odds of someone coming in with full stick and everything.
Wow.
And then she got up on stage and sang and blew everybody away. Everybody was whoa, she's awesome. So yeah.
That's pretty funny.
Yeah. It was
fun. Yeah, we just hung at home, avoided crowds, went in our pool in our backyard. This is our staycation week. So nice. We're home for the week. We go to Cape May area for that dance competition toward the end of the week for 2 nights, but for the most part, we're home. So we were outside a lot, did a lot of reading.
Nice.
It's always a good thing.
Good.
Remarkably Bright Creatures, the octopus book. Mm-hmm. Did you read it?
No, it's on my list.
You need to read it. It's so good. It's easy, fun, and I'm reading Project Hail Mary right now. So
nice.
That
I heard that
one's
one's
coming out. So I was all right, I have to read it. So I got a lot of reading done. That's exciting for me.
Nice.
My kids are come in the pool. I'm I'm in the pool while reading.
Well, I brought down to AC a book with me to read. I'd started it a while ago, and then the bookmark fell out, and I couldn't remember where I stopped it, and I didn't feel like starting all over again, so it just sat there. But I will read it eventually because I'm planning to cover it at some point.
Oh, okay. So it's a pod book.
Yes, it's a pod book. And then, one more fun thing before we get into business. I went to the head spa. Have you heard of this situation?
No. Do they do things to your head?
Yeah, it's they do a scalp massage, shampoo, a head massage. Some of it comes with a facial. Other places will do a hand, arm, foot massage as well. It was pretty cool. I would do it again.
Okay. I mean, I could see if they do head and a little bit of your neck, probably the top. I could see doing that.
Yeah, it was pretty nice.
Nice. Yeah, I need some spa treatments.
Same. Time. Maybe we need to have a spa day. No recording at the spa day.
No recording. We
could record after, when we get drinkies after the spa day.
You're not supposed to drink, I think, after all of your...
Oh, shush.
After they do all that massaging, they say drink plenty of water and all
drink a water and then a mimosa and then a water and then something else.
Sounds good. All right. So have you yet watched the show I'm going to cover?
I have not.
Okay. You have to watch it.
I need to.
All right. So since day one, when we started this podcast, every single person's comment was, you need to do the Pitt. every single person I've ever met about the podcast. Thing about the Pitt is it is actually the literal most realistic medical show I've ever seen. Like absolutely hands down, technical, everything about it. But there's a ton of like stuff covered. So I sort of took something medically related, but not a medical diagnosis to cover because I felt like it's an overarching theme throughout the whole thing. So I don't know if you've heard about the way it's set up.
Not really.
It's one shift in an ER. Okay. So each episode is 1 hour of that shift. So I think there's 14 or 15 episodes and each one represents an hour of their shift. So if you think about
a season supposed to be like 24 hours?
14 hours,
okay.
15 hours. Basically, they stay a little late, but it's supposed to be 15 hours. It's one shift. So it's very, very interesting when you actually go back and think about how many things occurred in that time period.
Do you feel like that part of it is realistic?
I think for a trauma hospital, it is. This is supposed to be a level 1 trauma hospital in Pittsburgh, hence the name The Pitt. I think in a small community hospital, you're certainly not going to see the acuity of the things that they saw there. But for that, I could see so. And this is all supposed to be first day for new residents and new people rotating through. And that's this time of year, actually. Mm-hmm. July 1st, all the residents start. All the first years become second years and so on and so forth. So that part's realistic. People getting thrown in, not knowing what they're doing. So that whole part of it I felt was pretty realistic. I couldn't find pretty much anything technical that they did wrong. And that's really hard to do on a medical show. Mm. Like there's a lot of medical shows where you'll be like, that's not even an IV. Like, what did you tape to their arm to look like an IV? Like some of them are really badly done.
Yeah.
You know? So this was pretty cool. I totally binged it within a few days. So, basically like we, kind of talked about the premise. So it brings back, what's his name? Why is my brain out? Noah Wiley. There we go. From ER.
That's the only thing I know about this show.
Yes. So he was like an original on the other very realistic show. That one had a lot more, I think, personal drama though, ER, whereas this one's a lot more clinical drama. So he's like the attending of the day in the ER, Dr. Robanovich, but they call him Dr. Robbie. And, there's a cast of characters. There's the charge nurse, there's the third year residents, the second years, the students, the new interns. And it really, it shows the kind of interplay of everything. And I really love the way the charge nurse was played.
Wait a minute. I just realized we forgot something. Your cocktail.
Drink. See, I just got so excited. I got so excited. You are correct.
Well, go ahead. Tell us the rest of the summary and then we can get into your cocktail.
All right. So yeah, just as far as like the show itself, one overarching thing that you kind of see from the beginning of the first episode that kind of continues on throughout is patients who are angry, patients who are upset because they've been waiting too long. And there's one particular gentleman who you see in every few episodes who's been in the waiting room. And he's in the waiting room saying he had chest pain.
Well, that's not good.
Well, yes, but they have a triage system. So he already got an EKG, a chest x-ray, and blood work, but there's just nowhere inside for him to be. And they've deemed that his heart score, they use all those things to develop a heart score, and his acuity is very low, and the likelihood this is actually a cardiac event is very low. So other emergencies that are more emergent keep coming in, and he's getting passed. And then he keeps getting more angry.
As far as a former creative writer, you don't put someone in there in the plot for no reason.
Mm-hmm.
So something significant is going to happen with him one way or the other.
Exactly. So, you see him, like I said, sporadically throughout the series. You see another episode of a family getting upset, not related to him, where they push one of the doctors. So you see sort of that end of things. And after that, they even kind of talk about, yeah, it's happened to me. Yeah, I've been punched before. Yeah, it happens, all the time. But essentially the way this particular guy escalates is after God knows all hell has, these people have gone through all day. The charge nurse sees him in the waiting room. He's, upset or whatever. She's behind the glass and she's trying to calmly de-escalate him, reassuring him, that he's going to be seen. And, he feels basically upset about that and that he wasn't addressed. And then later you see her taking a break outside, smoking a cigarette. I guess everyone in healthcare doesn't practice what they preach. And he's walking out of it with his, he signed AMA papers, and he walks out of the hospital, sees her in the ambulance bay smoking a cigarette, rips up his papers, punches her, knocks her to the ground, knocks her out, and then keeps on walking. So it looks shocking, but the problem is it's not uncommon.
I was actually expecting more.
Right. This is nothing. This is very, very little. This is very little. There's a lot of other violent things that happen in this show, but it's because it's so the norm. And she basically comes back in and is like, no, I want to work. And they're like, you're kidding me. Mm-hmm. And you have to get x-rays. You have to do this, whatever. And she's very stoic and whatever. But you see throughout kind of the very end, her questioning whether she's going to throw the towel in and go work in an easier department. She's been doing ER her whole career. But you see as the episode goes, even though she's toughing it through, she's kind of talking about maybe I will take a step back. Maybe this is the last time.
Right. And I'm sure you'll talk about your own experiences if you have any.
Well, that's one thing. Yeah, I wanted to ask, have you ever been pushed or assaulted in any way?
I've been bitten.
Okay.
Yeah, I've been bitten and had to actually go get medical attention for it and then come back, and it felt so surreal that it was happening, that while I was going through all the steps of having to go like to occupational health and get checked and all that stuff, I just kept saying like, well, I have notes to do and what's going to happen to my other patients. And it's like, I think sometimes when something so jarring happens, you kind of want to log in to mentally to like that, your regular steady stream. It's like not let it bother you and not let it get to you.
Yeah.
And then it was a child that I was bitten by, but that means nothing because they sometimes can bite harder than adults.
Right. Absolutely.
They don't have the same sort of filter or caution. And so the entire time too, I remember myself like saying like, did I do the right thing? Like, what did I say? What did I do? And it is what it is. And I'm not going to go into detail of it, but I had to get like a tetanus shot. Like it was significant. He bit through clothing and broke the skin.
Yeah. Yeah. I mean, it's definitely something. So the experience that I've had was also really in the psych space. When I was doing the medical consults at this inpatient, I came in to do the patient's history and physical. It's on the higher acuity unit, but in general, if there's somebody that you need to be warned about, mental health workers would let you know and go in the room with you. But there was nothing particular about this. I'd met this guy before because he was a repeat admit, and I'm taking his history, and he started getting very worked up about some previous event that had happened in the regular medical part of this hospital where he felt like he was whatever. And he kept getting himself worked up and worked up and worked up. And I had a clipboard and I'm writing, and he just basically took my clipboard and just pushed me backwards like a few steps. But it was enough to kind of like make me stumble and push back and then like exit the room. But the problem is I let him, which I learned, get between me and the door, which you never should do. And it was just the way the room was set up and the way I was standing. And in the beginning of the conversation, there were no red flags. And it was a patient who, I think had a history of amphetamine use, was very very irritable. And I should have
because I used to be a domestic violence probation officer. So that's DV 101. Always know where the exits are, always have a clear, ability to get to the access. It's always know how to call for help if you have an emergency button, or sometimes certain places you'll have a wearable emergency button. So just always being aware of safety, because I think it's easy to become complacent in those situations.
It is. And I had a wearable button. I don't remember I think I did push it. I don't remember exactly. But one other time I was wearing that wearable button in the pediatric unit, and the little girl's like, what's this? Beep. And hits the button and all the people come running. So, but yeah, it does work. I mean, they do help you. I would have to say, with the acuity of the patients there, that was really the only time, thank goodness. But I did see other people did get injured, other mental health workers. And I know one of our social workers got really hurt.
Yeah.
Punched like out of work, really hurt. Yeah. Like facial trauma out of work, like big deal.
Yeah, I hear about it a lot. I would say I've been threatened very aggressively and violently more often than something actually occurred from it.
Right. I think emergency room and psychiatric would be the two departments that probably be the highest level of danger, because the emergency room is urgent care as well. It's just people want what they want right now, and you're doing your best and you're running around, and it all just sort of bubbles to the surface.
Right. And then like with psychiatric ward, you don't know what else someone's responding to. So it could be some, internal. Like hallucination, delusion, things like that. So it could have nothing to do with you. And then it's just the wrong timing. But I do feel like in those psychiatric settings, you get a little bit more warning. You see maybe some more physical agitation, like pacing or tensing or things like that. You get a couple of mild warning signs versus some of these other things when otherwise people are psychiatrically sound and they're just pissed off and they're going to lash out at you. Sometimes you don't see those warning signs. I think that's scarier, honestly.
Yeah, when it comes out of nowhere. Absolutely. I mean, nursing homes, yes, I've had fragile little old ladies swinging, but I'm not too scared of that.
Hey, maybe you should be, because
they do have superhuman strength sometimes.
They do. And they've lived their lives. They give no fucks. They don't care anymore. They'll take you out.
All right, real quick, before we kind of review some stats, I just want to do my drink.
Yes, talk about your cocktail.
So the Steel City Sundown, which is supposed to sort of look like a sunset.
And isn't Steel City Pittsburgh?
Correct. So capturing the fiery spirit and colors of a Pittsburgh Steelers game at sunset, this cocktail is sizzling with bold flavors and a dynamic presentation that'll make it the star of any game day. This
and
is not
for those
sport
who don't
related.
know why it's Steel City, because there used to be a lot of iron and steel mills in Pittsburgh. Not as much anymore.
Yes. So it's 1.5 ounces of bourbon, 1 ounce of amaretto, 2 ounces of orange juice, 1/2 ounce of grenadine, 2 dashes of Angostura bitters, and then club soda to top. And you can use a maraschino cherry or orange slice for garnish.
That sounds yummy.
Yeah, it's pretty light. So I didn't have amaretto, but I knew I had amaretto syrup from a previous thing. So I just needed that almondy flavor. So I just used that. So it's a little sweeter than maybe it would have been without that. But I wanted to get that in without having to go buy something else. So in a shaker, you take the bourbon, amaretto, the orange juice, and the bitters. You shake it up, strain it into a highball glass that already has some ice in it, and then you slowly pour the grenadine, and it will sink to the bottom and look like a sunset. And then you top with a little club soda and throw your accoutrements on. So it's pretty tasty. I like it.
Sounds good.
And then I threw, I think, a mocktail also possible version. I think you can use they have bourbons that are like 0 proof. And then you could use the syrup like I did, and essentially you get that.
Nice. My drink, in case you were wondering, is the mango strawberry cider from Tomasello Winery.
Nice. Mango. Oh, I made a version of the wine slushy that you had today.
How was it?
So it was good. I took some leftover lemonade we had and I froze an ice cube tray. And so I threw that in the blender, and then I used the that raspberry blush. Mm-hmm. Did that, blender, done. Perfect. Nice. It was like filled it, dumped it, done. I don't think I measured. I just kind of visually did it, but it came out perfect. And it was nice because it was super hot out. So yeah, that was cool. So, just as far as like workplace medicine, it's a lot of stats, a lot of kind of boring information. I mean, the human side of it obviously is more what we see, the person to person and what the workplaces are doing. But 73% of non-fatal workplace injuries from violence occur in healthcare. Like of all industries, that's like, we're talking firemen. What? It's medicine.
Because a lot of times the cops and the firemen are bringing them to us.
To us, right. 91% of ER doctors report that they've had either personal or secondhand assault. And 75% of Texas nurses experience violence or verbal abuse in 2024. So it really is pretty high. And then if you take, those are specifically like ERs, but if you take a look at all of healthcare, 8 to 38% of healthcare workers globally experience physical violence. Mm-hmm. And so some of these escalate. And actually, when we have one of our guests on, although it's not quite the topic, she has Caitlin Kelly, who we're going to be covering her book and interviewing her. She actually had 2 times where there was a person with a gun coming into their place of work. So we're talking fists, violence, pushing, but somebody coming back to your place of work with a weapon or a knife or, whatever, that's even scarier because you've also had forethought. You've had enough planning, right? And there are quite a bit, of cases that have been in the news, and a lot of this does end up like affecting us with burnout. Retention issues, like who wants to keep working in this kind of environment? And a lot of it is, what do we do to fix it? It's very complicated. It's not like a straight up issue.
Right. Well, and I think something that was more recently in the news was that gentleman, that might be a loose term to use, who shot the United Healthcare CEO. Mm-hmm. And that was somewhat related to this, as far as him feeling like he was not getting the treatment he needed, or the insurance coverage was not helping him get the help that he needed for his chronic pain. And that was his choice of how to resolve it. And obviously he's still going to be in pain, and now he's getting even less healthcare in prison.
Right.
So,
in prison.
Unfortunately.
True.
Yeah.
And they say that a lot of this actually got worse and escalated during COVID, and a lot of nurses were, being harassed for enforcing safety protocols because they had to say, you can't come in without a mask. We have sick patients here, or you can only have 2 visitors, or we have very specific visiting hours because we're trying to keep less people in the building. And
so times when there were no visitors allowed at all, I'm sure they got a lot of crap from people for that.
Right. At least I guess if you could security can stop someone at the door, but once someone's in there and they're roaming around, who knows what happens if these are family members or whatever. There's been a couple different shootings. There's a big one at Mercy Hospital in 2018 where 3 people were killed. In 2025, there was an ICU hostage crisis with multiple injuries and deaths in a UPMC in Pennsylvania. Another one, I feel like a couple in Pennsylvania. Another one in Jefferson Hospital in Philadelphia in 2021. That was a staff-on-staff shooting. Again, like internal dynamics, mental health. And it's scary. They're saying ERs, ICUs, and parking lots are the most common locations. So you've worked all day and you're leaving your shift, and then you can
Someone's waiting outside.
Right. And that's similar to like in this story where the nurse is outside having a cigarette. She's on her break for that moment, puts her guard down, and boom,
Well, I did have, when I was working in the prison, I had one gentleman who was not pleased with me, and he just so happened to have the garbage duty, and so he knew what car I drove and my license plate, and he was able to look up my address, and he told me all of that. Wow. He didn't actually do anything, but he made these threats about it.
Because he walked out.
He was able to go outside to put the garbage out, so he
was able to see
what my car was, and then wrote down the license plate number, and then it was a minimum security, so they were able to have internet access, and he was able to look up my driver's license and find out my information.
That's scary, especially in that type of a setting.
Yeah.
Wow. I mean, I guess anyone could Google me, right? I mean, I keep obviously the social media for the pod out there, but I keep my personal private. But I'm sure that it's easy enough to find someone. Right. Exactly. That's kind of scary if you think about it. I don't want to think about it.
I think, too, it's in that situation, I did confront the person, and he and I and the warden had a meeting, and he was just really upset with some psychological recommendations I had made. And then when we sat down and we talked about it, it was almost like he didn't understand, even though we had a full out meeting about why these recommendations were made. Like, there was a full meeting with the Department of Corrections about, this is my recommendation for you. This is why, blah, blah, blah. But I guess all he heard was, no, you're not going home. You're going to a halfway house. And that was enough for him to just kind of be like, okay, well, forget her. But then when we sat down, and I was like, look, I want you to go there so that way you don't end up back here, so that you're able to get your feet, under yourself and get what you need, instead of getting caught up in that cycle of, reincarceration that so many people do get stuck in for just because of the way the system is broken, and it's set up in a way that was not going to benefit him. And so I felt that him going to that halfway house, and it was like ridiculous. It was going to be for like 30 days. So it was like, yeah, like your whole life.
Not that big of a deal. Right.
And thankfully, knock on wood, everything ended without an issue. And to my knowledge, he's out there doing well, and I wish him the best. But, sometimes I think I bring that up because I think a lot of this aggression and violence towards healthcare people is a misunderstanding of why things are done or why things are not done.
Right. That's absolutely it. Long wait times actually is one of the issues. Other triggers, obviously we talk about mental health, substance abuse, social media driven mistrust in medicine has obviously escalated in the past 5 years.
I would imagine chronic pain's probably a big one too. Pain to drive people to do a lot of things.
Absolutely. And, but the thing is, it's become sort of normalized where a lot of healthcare, throwing your microphone at us. It's because I told you to make it taller. Sorry.
My microphone was like, nope, I'm done. Okay, sorry. No.
But we've become accustomed to saying it's part of the job, right? Mm-hmm. And so there's probably some underreporting there. And Definitely. Then, in the end, physical injuries can happen. Like you said, I need to go get a tetanus shot. You had whatever. I didn't have any, maybe a little tenseness in my neck from being pushed, but nothing major. Mm-hmm. So you kind of like brush it off and keep going. But that happening over and over, or having a bigger injury could, of course, cause something like PTSD. I mean, absolutely, if you have a bigger event.
And it can impact your ability to work. You could not be able to work anymore if your injury is big enough.
Right. Absolutely. And for the system itself, then we have staff who turns over. We don't have proper staffing, which just really feeds into the long wait times and shortages. What's the answer? I guess, what do we do for it? I know that There are some legislative efforts. I think there is Workplace Violence Prevention for Healthcare and Social Service Workers Act. I don't know if that was passed because I don't have a citation here, but I feel like often it isn't reported to the authorities. It's internally handled, right? But should it be reported to the authorities?
It depends on the situation. Like the guy pushing you, no. But if someone's coming in with a weapon, absolutely.
Right.
Yes.
I mean, yeah, the one, like I said, social worker whose whole face is, was out for months. Absolutely. Yeah, I guess, yeah, where's the thresholds? It's a little,
maybe it's part of the intention too. Like if this is someone who was coming back with intent to harm versus someone who was having a psychotic break, someone who, it was impulsive and they're apologetic afterward. I think there's a lot of things that go into it that make it not so easy, but there should be some sort of regulatory agency tracking this data. Even if it's not going to result in like prison time, there should be someone tracking this data and the types of violence and the amounts of violence and figuring out ways to address it.
Right. What we can do as a system to help fix it.
Yeah.
So, local measures, like we said, panic buttons, de-escalation training, surveillance upgrades, but obviously you can't have, cameras in a patient room, but maybe some more public areas having, better things there.
Technically you can, you just can't have it in a bathroom. You can't have it where someone would be undressed.
I don't know the legality. I just feel like, yeah, but they're undressed often in the room because that's where all their care is done. That is where they might be getting wounds changed. That's where, you're examining them. So I don't think you can. And then hospitals, like really providing support and actual validation, you know what I mean, to somebody who goes through this, because I think that's another thing. Like
we've talked about that before, about burnout and in healthcare and some of these things that these systems aren't doing to support their employees.
Yeah, but like, going through the, occupational therapy stuff, and then at the end of that having like, is there anything else you need? You know what I mean? Yeah. Checking that mental health check-in sort of, it doesn't really exist, but what's interesting is, I think going back to the Pitt, they actually said that like, as I think Noah Wiley's one of the executive producers, that they really, really wanted to make this as true to real medicine as possible. And they wanted to show those grittier parts of things. And maybe it opens some people's eyes, hopefully, to what
I feel like your microphone's going to fall again. Sorry. What's happening? What is life right now?
It's because I told you to make it taller and I messed you up.
Fault. Okay, sorry.
I told you to put a book under it. That was my suggestion.
Well, it has a tripod. All sorts of things are happening today.
But, what can we do? Support, legislation, hopefully, if it comes out, and continue to talk about it, and just respect our healthcare workers. They shouldn't have to risk their lives. Like, it should be something that, like, I don't think any healthcare workers are in it because they don't like people, or they just, like, yes, you get a paycheck, but I don't think anyone goes into medicine because they want to screw you over and make you wait in line. Like, I don't think that's anyone's intention. We're all out here busting our butts, trying our best. And understand that there's always a method, even in the office. Like, I'm lucky because I'm in a small practice, and once in a while we had one patient, I had to kick out because she was escalating, cursing at my staff, like verbal abuse. But I don't really have any risk in my office that I can see a physical. And if there was, that I would absolutely have the patient out and cops called and whatever. But, I kind of lost my train of thought. I started
to manage workplace violence.
No, I had another
staff.
I had another thought. Well, that's not where I was going, but it is a no tolerance. Like, you curse at my staff and you belittle them. Sorry, you got a letter to go. But in general, it's not something that I necessarily encounter on a day by day basis, but it can happen out of nowhere. Yeah. And I think just, supporting and trying our best to be understanding. Oh, this is what I was getting at. Sorry, I remember now. Like appointment times. Okay. So your appointment is at 9. This person's appointment is at 9:15. If you show up at 8:30, or I'm sorry, let's say your appointment's at 9:15 and their appointment's at 9, but you show up at 8:30, does not mean you get to go before the 9 o'clock if you're at 9:15. And then people get mad. I've been waiting for 45 minutes. I'm like, because you showed up 45 minutes early. What am I going to do for you?
And I have the opposite in my field, because when you come in for psychological evaluation, there are copious amounts of paperwork that you must fill out in person. It's not in the portal. It's not ahead of time. There's things that you must fill out in the office because there are safety checks that we look. So we need to see you answer them in person and then deem you safe to go home. And I cannot tell you how many people we tell them come in 45 minutes early for paperwork. The paperwork takes 45 minutes. I'm not making that up. I'm not trying to throw off your day. If you then are 25 minutes late for your scheduled appointment time and then still have to do paperwork, the whole day is thrown off.
Right. Everything's thrown off. And it's like, I feel so bad if I get behind, but like it happens once in a while. But luckily, most people are understanding. Really, most people are in my setting. I do feel for ER and urgent care. I think that's like down in the trenches of really, and it, especially urgent care, because hospitals are hospitals, right? And their job is to, I don't know if anyone understands this, but their job is to treat and either admit you or get you discharged. Like that is it. They are not here to solve your long-term medical problems going on for 50 years. They're here to make sure right at this moment you are not having something that is unstable and do the best they can.
And they're not appointment-based. So you show up when you show up,
right,
and you wait until they're free.
And they go by acuity. And so people who are higher acuity or more at risk are going to get bumped up.
Right.
Urgent cares, because they're corporate based for the most part, do value like those scoring systems and patient happiness
Hospitals
and
do
things
that
like that.
These days.
They do.
Press
They
Amy
do.
is like
right.
the bane of my existence.
Right. Yeah. No, they do. But I feel like urgent care, because it's quick medicine. Well, I came here paid a copay. I want medication. Well, for what you have, there might not be a medication. It is just supportive care over the counter. There's really nothing. But I paid a copay, but you paid a copay for my professional advice, not for a prescription.
I had someone once who had an intake appointment with me for testing, and what they were requesting for testing was a neurological issue where a neurologist would have to do brain imaging for this person. And so I explained to them that was why I could not help them, and I gave them the names of several neurologists, sent them on their way, and then they proceeded to complain both to our office and to the insurance company that they shouldn't have to pay, and they hadn't met their deductible, so they had to pay out of pocket. So they said that they were not going to pay for the session because they didn't get what they wanted. And I said, but you got the consult, and that was what you wanted.
Right. You got the consult, you got the time, you got your professional opinion. I spent a full hour and a half with someone who I can't even do anything with, but I spent that time explaining to them why I could not do that and getting them to the right people. And then they didn't want to pay. So. All right, so our bitching session is
I think this is relevant because unfortunately, and we talked about this a little bit when we talked about workplace burnout for healthcare professionals, is there has been a shift where medicine is looked at as customer service, and it is not. Of course, we should be polite to all of our patients and treat them with respect and do well, but we are not customer service. If I go to my doctor and he tells me I'm fat and I need to go on a diet, I don't want to hear that, but I can't complain or not pay him because he told me something that is true.
Yeah,
there's a lot of people out there who that's not their mindset.
I know. It's a weird world we live in, but we're all out here just trying to help people. I swear that's our intention.
And you're right. I don't know a single person who works in medicine or social work or psychology or psychiatry or anything that is doing this for the money, because it is not a money-making profession. It is a people-helping profession, and that's why we do it.
It is. I know that both of us, at least, we put it all in and try and help our patients. And I believe that in most people. So, it's watch the Pitt because it's fun. This is one overarching. There's a whole lot, another violent thing that happens, but it's not against healthcare workers. So you'll see there's a lot. There's a sad episode, just like trigger warnings for all the things that you could have trigger warnings about. Yeah. But highly realistic. Couldn't get enough of it. Can't wait for season 2 to come out.
Nice. Speaking of trigger warnings, for something that we talked about before, if you have not watched season 2 of Yellow Jackets, they explore cannibalism as we had.
Okay.
They do more than explore it, but that's all I'm going to say.
All right. So thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers.
I tipped my glass towards you to clink it. Didn't work.
Clink.
Clink. Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon, patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.